My name is John Harrington. I'm Director of Pharmacy at Midland Memorial Hospital. I've been here since 2002. It's always good to see new faces. Thank you for coming. I hope that you will find your relationship with Midland Memorial Hospital as productive as I have found mine. There's an old joke, you need to keep your day job. Those of you who will be seeing this film in the future, you will understand that very, very well. Today, our session is on the culture of patient safety. Why is patient safety important? I need some volunteers. To keep people healthy. Is that not our job?
Yep.
Okay. What do you think is one of the most important aspects of keeping our patients safe?
Protocols, knowing their medications, knowing what they might be allergic to, knowing those things, so there's not a contradiction in what's actually giving medications to the patient directly.
Yes, knowing about our patients, what they're allergic to, what they're taking, making sure that what the different medications they're taking don't adversely interact with each other. When we look at patient safety and we look at errors that occur, what is the number one cause for medical errors, the root cause for medical errors in the healthcare industry? Close, lack of patient identification. Really, it's lack of communication. 68% of all medical errors, poor communication was involved at some point. And so you will find as we go through this lesson that communication really takes a high priority. Patient care services, our mission. We exist to provide excellent patient and person-centered care and services. Communication. If we know our patient, we will better be able to take care of them. And you know what? We only have 5 people from the nursing division in this orientation. But patient safety applies to all of us. If we're issuing a dietary tray and the patient's diabetic, is it important for the nurse to know, for us to tell the nurse, hey, I brought this patient's tray? Very definitely. Vision. We are committed to providing an environment which promotes healing through patient care partnerships. Partnerships. You have partnerships without communication? Our patients are part of their care, and how we communicate with our patients has a tremendous impact on their care, no matter what part of the service we're providing. Strategy to make every experience exceptional. I recently took a trip, vacation. Stayed in different hotels, both going and while I was at my destination and then returning. And there was one hotel that really stood out as exceptional. Why were they exceptional? The service was provided, but that's a baseline.
Communication.
Communication.
Catering to your needs or what needs will need to be addressed properly.
Yes. Addressing the needs properly, communication. One other night, we had stayed 3 nights, and we had a nice stay. One night we come in after the end of the day and our room wasn't made up. What was that? It's a breakdown in communication among their staff. And it took away from my stay, that one experience. took away from my stay there. And yet this other place, one little experience, two little experience, the way I was greeted when I came in, the way I was greeted by every person within that organization, even the little things, they had doggy bones for my pet there at the lobby. The only place I've ever stayed that had little doggy treats. And so the little things, the caring for the patient, for our customer, those little things make the experience exceptional. Excellent care is a baseline. Us knowing our job and being able to do it is a baseline. That is minimum. It is the listening to our patients and understanding how we can meet their needs. Values, excellence, baseline. Professionalism, baseline. Integrity, baseline. Innovation, you will find working at Midland Memorial Hospital, we have many innovative technologies. We have a patient lift in every room. We have vital signs machines in every room. We have a computer with the patient's electronic medical record accessible in every room. And so the hospital is taking care of much of the innovation. You're being here. You're a part of this organization because you're innovative, because you have chosen to excel in your particular career path. That is why you are here. You are innovators. And then compassion. The listening. When we go in to change a light, understand that there's a patient there and say, "Excuse me, I will be changing your light." Don't surprise them. Listen. When we leave the room, whatever position we're in, when we leave the room, we can always say, "Is there anything that I can do to help?" And that little thing, it may be something that's a nurse's responsibility, and I would have to say, I will communicate that to your nurse. But those little things, letting the patient know that we care about them. Because in all reality, it's not going to be too many years to where I will probably be one of those people that you're taking care of. Our professional practice model, compassion, integrity, innovation, professionalism, evidence-based practice, does it work in other places? Synergy model for patient care. Do we have the right employee taking care of that patient's needs? And then the outcomes is excellent care, interdisciplinary collaboration. We work together. Culture of patient safety. What's the first rule of medicine? First, do no harm. Ethical practice and excellent customer service. Some of the patient safety initiatives at Midland Memorial Hospital, each department has action plans for our patient safety survey. Patient safety survey is something very interesting. I won't spend a lot of time on that, but about every 2 years we do a patient safety survey. Research shows that the employees know how safe an organization is. You can do all the statistical analysis on post-surgical outcomes, on 30-day readmissions, but you get more data from this patient safety survey very quickly and easily. And so we do that every 2 years. I'm director of pharmacy. I am required to, and I enjoy doing it, evaluate what our employees are saying about pharmacy and how do we need to change to make it more safe for our employees. We have just culture. We have a reasons unsafe algorithm, which we will discuss in a few minutes. We have leadership walkarounds. Throughout the year, every person in administration will visit each department at least once. Dr. Dent visits each department in his area about 4 times a year. And so what are they doing? They're getting employee feedback back to the patient safety survey. Our employees know whether something needs to be changed. And then we have team steps, which we'll discuss a little bit in the future, further down. Safety first, people first. Can we have safety first if we don't put our patients first? That is something that we have to do. I was at a conference last week. The CEO of Baylor Scott and White Systems, he said, number one, every decision he makes, does it positively impact our patients? Just culture. Excuse me, I'll back up. You each have a copy of the Just Culture algorithm in your packets. And it's a decision tree. Years ago, and I've been in this field over 40 years. When I first got into this field, we had basically 3 strikes and you're out policy. You make 3 mistakes, you're fired. And what happened when you have that? You have high turnover. What else do you have? People are afraid to report. What's harder to report on myself? Report on my peer. And so we swept things under the rug. And if you look at the Institute of Medicine report that was published about 12 or 14 years ago, that basically demonstrated what we were talking about. People were hiding errors and not finding out how to solve them. And then we did a flip-flop. Pendulum swung totally the other way. All errors are system problems. And so we did a real good job of getting people to report errors, and we did a real good job of identifying things in our systems, how we do things that set the employee up to make an error. But still, we had what we call never events. We still had wrong site surgeries. Didn't happen as often, but they still happened. No matter how good the system, we still had errors. Several years ago, Midland Memorial Hospital looked at this dynamic, did a lot of research. There's other institutions that have researched this, and we have developed a Just Culture algorithm. And basically you go through, and you can go through this. Were the actions intended? Yes. Were the consequences intended? And if we've got somebody that's doing intentional actions knowing that bad consequences are going to happen, we've got a person problem, not a system problem. Is there evidence of illness or substance abuse? Are procedures knowingly, are safe practices knowingly violated? And here's another one. Could someone else have done the same thing? Hey, we might have a system problem. It might not be an education problem. It might not be a person problem. And so this algorithm is designed to identify whether it's system problem or person problem. And if it's a person problem, does the person need to be educated? Is there something, do we need to change our education program? If the person is educated and the problem still persists, what do we do there? And so this algorithm is what we consider our best way to be fair to the patient and to be fair to the employee, but not compromise patient safety. We have nursing peer review for those of you who are in the nursing department. If things happen that have adverse outcomes, maybe your boss has one idea of what the problem is, and maybe the employee has a different idea of what the problem is. And so we have nursing peer review, where a group of nurses who work in situations much like the nurse can evaluate the situation. And then we have team steps, team strategies and tools to enhance performance and patient safety. This was developed by the Department of Defense. What did we talk about earlier? And excuse me, I've got my notes here. What is the leading cause or the leading influencer in medical errors? Poor communication, breakdown in communication, missing one key point. On most surgical errors, somebody on the team knew that there was a problem. Maybe didn't know what the problem was, but just had that feeling something's not right. And so communication is very important. Oops. One of the things we learned through Team Steps, and those of you in patient care services will get a Team Steps training, teams are better organized. We're here as a group, and I'm director of pharmacy. Now then, do I know more than everybody that works for me combined? Have 45 employees? No. There is no way that one person knows more than the team. Now, I'm required and have the responsibility to lead the team and make decisions, but am I going to make the best decisions by being, quote, the Lone Ranger and saying, I'm the boss, we're going to do it this way? Or will I make better decisions if I get input from other people? Feedback from other people, being willing to listen, is very important. Being willing to speak up is very important. When I'm speaking to someone that has 12 years of education and 20 years of experience in their field, am I intimidated about speaking up? I shouldn't be. If I have a concern, I should be willing to speak up. I should not be intimidated by that person's education. We have briefs, we have huddles, and we have debriefs. Briefs are nothing more than planning session. We've admitted a new patient, and the care team gets together and goes over the admission assessment. That's a form of a brief. Whenever we have shift change and we hand off to the next nurse, that's a form of a brief. A huddle is a problem-solving session. We've started our day and one person's called in sick. We have 5 people in the emergency department, and we're getting phone calls like crazy. We have a huddle. We reorganize for that situation. And then debriefs are process improving sessions. Where do we always have a debrief? Every time we have a code. A code where we hear overhead code blue. Somebody, one of our patients or one of our employees is in severe distress. After every code, we go through, those that participated in the code, go through a review of the code. And it's a formal form of debriefing. We have the 2 challenge rule. Real story. We were buying some equipment for pharmacy that nursing was going to use. And I had a bright idea. It was IV pumps. It was before we bought the smart pumps. I had a bright idea that we would buy all the pumps alike and then we'd have more variability on how to use them. 2 of my employees said, "John, that's a bad idea. We need 2 different sets of pumps, color-coded." And I said, "No, 1 set of pumps will be fine." Those 2 employees scheduled a meeting with me and said, "John, you're about to make a big mistake." You know, when they scheduled a meeting with me, it got my attention. And I'm forever grateful because we got 2 sets of color-coded pumps. The mistake that might have occurred, we'll never know. But I do know that throughout that process, we did not have a single error for having the wrong pump on a patient. Forever grateful that they used the 2 challenge rule. Another rule that we can use, another communication tool we can use when something's going wrong that we're just really uncomfortable about. I am concerned. It's not, "You're about to mess up." I am concerned. I am uncomfortable. And this is a patient safety issue. Real case, had a vendor. We need a computer disk. Yes, we already had the computer disk somewhere in the hospital. We can't find the computer disk. I was on vacation. Staff emailed, called. I get back from vacation, about 4 days back from vacation, we still don't have a computer disk from the vendor. It has already been established we can't find ours. And this is what I used. I sent an email. I am concerned. I am uncomfortable. And this is a patient safety issue. 24 hours later, the computer disk was in the pharmacy delivered by Federal Express. Once the person receiving clearly understood that this was a patient safety issue, they took care of it. It was just a computer disk. But that computer disk was important for patient safety. And so communication. When I'm concerned, is it better for me to say, you're wrong? Or is it better for me to say, I've got a concern. Will you listen to me about my concern? Yeah. The second response, I'm reading a book. And basically, one of the things, I read it last night, and it's on communication and on mistakes. And it basically says, for every problem, there's two potential responses. One will pour water on the fire, and the other will pour gasoline on the fire. Does that not describe communication? When we're faced with a difficult situation, we can respond one of two ways. We can either accept ownership for our concern and not paint somebody else in a corner, or we can just fly off the handle. And when somebody's flying off the handle with me, what's my response? I defend myself. Absolutely. And then I have to go through the emotions before I can face the problem. I have to deal with my personal emotions. So anyway, communication, non-threatening communication. Do I have to be willing as director to hear what my employees have to say for us to have an effective pharmacy? I think so, and I think you agree with me. Whatever our position is, we need to be willing to listen. This is prepared by Dr. Dent and Corey Armstead within Patient Care Services. And we have a few minutes, and I want to just talk a little bit. I've been around healthcare business since before all of you were born. There are some in here that I've been in healthcare business since before your parents were born. And so I've learned a few things. But when it comes down to the root cause, the very basic of what makes us excellent, outstanding healthcare providers, it's us. We can be competent. We can have the best equipment. But when it comes right down to it, when I come to work and I'm tired and chaos is happening, how I approach that day is a reflection of the decisions I've made about my life prior to that day. The decisions that I make in my life that guide my life day in and day out. I used to work small hospital, and when I moved out to West Texas, I started work in a 400-bed hospital. And I remember going home, and almost every day I would tell my wife, we would have had a good day except 400-bed hospital. There is a problem or several problems every day. Something that doesn't fit the processes that are established. And in this hospital, we're just under 300 beds. Every day, something is going to occur that doesn't fit the normal routine, that we have to go out of our daily procedures to handle, and it's going to be inconvenient. And yet, how we handle it is based on the choices we have made about our life. One day, back to that other situation, I realized that a normal day had 1 to 3 anomalies every day. When I realized that that was normal, guess what happened to me? My job got easier and everything got better. How our job is a reflection of how we perceive it.